For previous generations, autism was only understood as a severe expression, profound, don't talk, often going to special school and institutional care, a lifelong disability. And so how can you say my grandson or granddaughter is autistic? Because they're not like autism as I knew it years ago. In other words, they're out of touch with the changing understanding. I use the metaphor of visual impairment. You can have somebody on that dimension of blind, yes, very obvious. And there are people who need glasses. Now, technically, I'm visually impaired. Now, I'm autistic. I can't read your facial expressions because they're all out of focus. But in autism, we can't suddenly give them a pair of glasses and, I know what you're feeling now. We can't do that. So there is a continuum, and people need to be aware there's that continuum. They also need to be aware that people can move out of autism. And this is a very new phenomenon, clinically and in research studies. Round about at least 15% become what we call subclinical. In other words, it's a developmental delay, not an eternal absence. And so one of my enjoyable aspects is undiagnosing, only if it's to the benefit of the individual. But the characteristics become subclinical. They've learnt it. And this new generation have opportunities the previous generations never had. And so this now becomes a description of personality, not pathology. And so it is possible to move out of autism. And people need to know that. I can't accurately predict who it's going to be, but eventually you can reach a state where I'm talking to the person and relating to them. I think, where's the autism? I've just given you lots of autism-related questions, and you've gone negative, 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 negative. And I say, yes, that was your childhood, partly your adolescence. But now, on any job application and things like that, it would not be appropriate to use the term autism because it's not accurate.